process of using CHROME to convert to a roto prosthetic. Let's go through the items needed when you're beginning a roto CHROME surgery. And these are all items back in the laboratory after you've completed the RAPID appliance. So you'll need a RAPID appliance, you'll need the take-home prosthetic, you'll need a roto model, you'll need a light cure unit, you'll need stellar material, which is optional. There's other materials out there, we prefer stellar. You'll need a few tips. You'll need a driver for the screws, and the screws for Smileloc are Nobel compatible. So in this case, we're just going to use an 048 driver with some Nobel compatible screws. And then the Smileloc components that are needed are analogs in order to make the model, copings that will fit inside the prosthetic. We will need abutments. In this case, all 6 implants are straight, so these are Smileloc roto abutments. And then you'll need a Smilekey, a Smileloc for each one of the sites. So those are the items needed to convert back in the laboratory, the office laboratory, after you picked up the RAPID appliance. All of these components, these parts, all come in basically surgical packages. They are not sterile, but this is the kind of package they'll come in. So this is a tall coping. This is the multi-unit abutment package that'll come in. The analog. And then finally the straight abutments. And in this case, we're just going to use 1 millimeter collar height, but generally you want to use 2 millimeter collar heights for both the angled and the straight, or if the angles are 30 degrees or 17 degrees, then we use the minimum height. 30-degree minimum height is 3 millimeter collar height. So let's start the process of doing the conversion. The roto conversion process starts with a RAPID appliance. Just like all of our CHROME cases, you'll pick up the RAPID appliance in the mouth, and then in surgery, you'll stop. You're not going to pick up the take-home prosthetic, only the RAPID. So once the RAPID is picked up, then the patient can be sutured, and the CHROME fixation base and pins can all come out, and you'll go through your process, post pickup, and then the patient will just kind of hang out until the roto prosthetic is converted. Now during surgery, if there was any bite discrepancy, you could have taken a bite on the take-home prosthetic. So in other words, you would seat this on the carrier guide, either really early in the process when you first put the carrier guide in, because then the muscles aren't sore and stretched from going through the whole surgery. You could seat this on the carrier guide and take a bite. And that way you could do an extra oral conversion with this on the roto model. Okay, RAPID appliance comes back into the laboratory, and the first step is to make sure that the RAPID appliance fits onto the roto model. It's very important that it fits very nicely. I'm going to zoom in here and we'll show exactly how it should be fitting. So these are supports on the roto model on this side and this side. You can see both these supports here. And then there's supports in the anterior as well. But what guides this into the proper place are the 2 pins, 1, 2. These are the same pins that were in the mouth on the pin guide. So now when you take this out of the mouth, the RAPID appliance, and you plug it into the roto model, it's just like you took it back to the mouth, okay? And it's nice and stable. So you can see that there's no gaps between the supports and the appliance. So we know that the prosthetic is fitting to the model. That's step 1. Step 2 is going to be connecting the RAPID appliance to the model. And we have a lot of videos on this with the C2F technology that shows the process. Essentially, you're going to add multi-unit abutment analogs to this prosthetic. You're going to plug the 2 together, and then you're simply going to backfill to connect the analog to the model. And we'll do that demonstration now. Okay, so I've already added the first one. All right, add the analog. So add another one here just for demonstration purposes. Right, so prosthetic screw, drop it in from the occlusal, and then just simply add an analog to that site. Because these are straight, really should be a very simple process to add them all, and then just plug it into the model. So I'm just going to demonstrate these first two, and you can see here that that they're fitting. This one's not quite in the middle, but it's not quite touching either, so that's acceptable. So let me add the other four, and then we'll move on. Okay, got them almost all in now. Add the last one. And one of the things that's important to observe is that these are fully seated, and you can see they are. You can see the seam between the abutment and the coping. All right, but that's very important because sometimes the material gets in here. If when you bring the RAPID Appliance back into the laboratory, sometimes you're filling little holes to reinforce it, in the occlusal or in the intaglio, and you can get some material in this. So be very careful of that they're totally flush down. Otherwise, obviously the parts are going to be in the wrong position, and surgery and the prosthetic won't be passive. Okay, so here's another check. It's still down, so we know nothing's holding it up, and the copings are all in their proper position right in the middle of the holes. So the next step will be to hold the two together and then just simply backfill to connect the analogs and basically make an implant model. So we'll talk our way through this whole process here. So let's, you want to make sure that it's down. You see that how it popped up. So you want to make sure that it's completely down. And one of the important things with this, and actually I'm going to hold it this way because some of these copings are closer to the, well, actually it doesn't really matter which end they're closer to because really they're about in the middle. So the point of this process is to connect the coping to the model. But what's the other very important thing is to not connect the prosthetic, not to connect the prosthetic to the model, right? In other words, we are holding this vertically so that you don't have material connecting, going all the way through the hole, get rid of that dot there, going through and connecting the prosthetic, you see the prosthetic to the model. That's a problem because then you have to cut the two apart. So to do that, we just don't put the tip in very far because we can always come back from the occlusal and backfill more of the hole, just to make sure the analogs are secure. Now the nice thing about these analogs is they have a very nice notch in them for undercut. So they really should be very securely fastened inside the model just based on that mechanical retention. So you see how I'm not putting the tip too far down inside the model because again, you don't want any material bonding that prosthetic to the model. So just put the tip about halfway in and then just keep it close to the surface. Okay, backfill them, and I'll be right back when it's finished. This last abutment here was a little close to the edge, so I'm just flipping the model upside down now. Still vertical. It's just I rotated it so I can really nicely fill the void between the coping and the analog. Okay, backfill. And then now, because Stellar is a dual cure material, I'm going to cure it in. And let me make sure that the prosthetic is down. Very, very important. Make sure it's down before you start curing. Okay, it's down. So now just hit it. And Stellar is a 20-second full cure with a light. Some lights are more powerful than others, but 20 seconds will have it really well tacked in. On. Okay, so I'm gonna keep curing this. Okay, they're all filled in. Looks good. I think I'm gonna stick with that. Probably won't fill any more material in. And then this is down here. So we know we are good to go. The next step will be to take this prosthetic off of the model, because we made a model, and then we will transfer this take-home prosthetic to the model and pick it up. Basically an extra oral conversion. So, you know, at this point, this prosthetic is just screw retained. So just take all the screws out. It's always the trickiest thing in these surgeries to remember which screw you have taken or not taken out, even in the mouth. I go to a lot of surgeries and doctors perform these magnificent surgeries and then we just get stuck on the screws. Okay, and should be one more. Yep. Oh, I didn't loosen the first one all the way. I can feel it pivoting right here. Okay, screw. Okay, so this comes out, and now we have a roto model. See how nice and clean it is? None of the material came through and touched the prosthetic. It's just perfect. Okay, next step will be to add the Smilelocs and the copings and then do a pickup. Okay, if you've reviewed our webpage on Smileloc, you'll notice the simple process of how this technology works. We have, let's just imagine this is a mouth. This is an MUA, okay? And on top of the MUA, there's a little Smileloc, and we'll show you in a minute how these are pushed down. But what happens is the Smileloc will stay on the abutment, and then the coping will just simply clip over it. Imagine it's here. We'll clip over it and clip in. Once it's clipped in, it does not come out without the Smilekey. So it's kind of like locators or other snap-in type of attachments, but they lock in because this coping locks in with the little fingers. See the little fingers here? Permanently. Patient doesn't take it out. It has to come out with a Smilekey. So let's go through and we'll put these little copings on. There's one. And the trick is that when it's on, you should be able to spin it. If it spins, see how it pops up? We don't want it to pop up. We have to put it on a little bit further until it spins. There. See a little bit of a spin, just like that. So I'm going to put all these on, and then we'll do the pickup. All of the Smilekeys are down, and this tool here, this tool is called the Abutment socket driver. And what you'll do is you'll use this just to make sure that the Smilelocs are down. You'll hear them make a little noise when they clip into place, and then you know they're down. And so once you hear the click, you know they are, but you can still test them just to make sure they spin. Yeah, so they spin, they'll spin a little bit, then you know they're actually down. See how easy that one spins? Some of them spin a little easier than others, but so once they're all in, then what we'll do is we'll put the copings on top, like that. All 6. And one thing that's important, that is very important, is that you see how these have an opening. They're developing some that have a closed top, but we need to block out that little coping so you don't get material down inside of the of the coping, and then the material will be down inside and it'll affect the Smilelocs. So we have to block out these little copings. You can do that before surgery. You can just open up all these packages and block them out. You can use PVS, you can use some composite. In this case, I'm just going to use a little dab of Stellar. Let me show you the process. It's very, very simple. You just put a little dab on top like that, and then just hit it with your glove. And it's a self-cure, so just let it set, and then add some to the next one. So just block it out. What you don't want, I'll show you here, just a dab. What you don't want is to penetrate the inside, because then it can interfere with seating. Just block them all out. And then because they are, because Stellar is a dual cure, I'm just going to go ahead and cure them in. The more curing you use, the more curing light time that you use, obviously the quicker the process goes, because you can wait 2 minutes or you can wait 20 seconds. Look at me, I'm impatient. It's a 5-second tack, but a 20-second full cure. I don't really need a full cure. I just want to make sure that they don't pop out, so I'm just going to kind of tack them in. Okay, now I'm going to add the rest of them to the model. They basically just clip in. You can hear them snap. You'll hear them when they snap in the mouth, when they snap out of the mouth back in the model. Okay, they're all blocked out. So the next step is pretty simple, really. This prosthetic needs some lingual ports, and it will come with lingual ports. I made this one as a demonstration, so I'm going to go drill out some lingual ports. But while I'm doing that, what you'll see is that the holes on the prosthetic are, they should fit intimately with the copings. But if an implant was placed just a little bit off, a little deviation, like you can see, this implant just looks like it's a little bit off. See that? Then you'll see that it's not passively fitting into the prosthetic. So I'm going to go open this one up, and I'm just kind of looking around. It looks like all the rest of them are going to be just fine. So I'm going to open this one up, and I'm going to drill some lingual ports, and then we'll finish the conversion. The adjustments are made. I drilled the lingual ports, just one on each site. One on each site, drill, so there's 6 ports. And then instead of just opening up the one site that we noticed that was a little bit, that was holding it up a bit, I went ahead and adjusted, opened up this, a little bit of this, these 4 sites, just to make sure we had a little bit of passivity, to make sure it's seated all the way, right? So you can see it's down, just like the RAPID Appliance was. And we'll move on to picking it up. And notice that there's some tips here. So Stellar comes with about 10 tips. Hold on to them. We've already used 2, and we're going to use a third now on the tube, and then who knows, you might use 4. So hold on to them, because you don't want to run out of tips. Okay. So what we'll do now is we're going to fill the prosthetic from the intaglio, and this is a Dr. Olson tip, and that is fill the labial part of the prosthetic, and that way when we introduce the prosthetic, the model to the prosthetic, and then inject from the lingual, then we'll be introducing material on the buccal labial and the lingual all at the same time, and really should be able to do this all in one shot, and very little cleanup at the end, and deliver it to the mouth right away. Okay, so let's follow the Dr. Olson protocol and load the wells. And we're going to load on the labial right up to the edge. And you only want to fill a well up maybe a third of the way. I think Dr. Olson gives little tips on how much to fill it. But just on the labial, do about 1/3. You can see it's about 1/3 of the well. And normally this would be pink. Just happen to have a white tube handy, so I'm doing white. But usually it'll be pink, unless it's an FP1 prosthetic. Okay, so that looks good. And then we don't want to flip this, because we don't want any gravity taking the material down to the model and locking it in. So we're going to introduce it this way. Okay, Okay, so you line up the chrome. Here, let me remove. There's a little bit of extra material there. We don't want to lock it to the model. Okay, so we're going to introduce the model. Then here's the trick that we've learned from doing a lot of these cases is keep the teeth down and then just introduce the material into the port until you can see it kind of bubble up back in the well. You see that? You can see the material filling the well, and it goes all the way up to the chrome, to the Smileloc coping. Inject until you can see it. So you can see a little bit of material in there. Might be hard to see, it's kind of back in the dark. But teeth down, backfill until you see the material. There it is, right there. Because we know we have some on the labial. We're just introducing on the lingual. So we know we're going to grab the coping. Okay, there we go. Hopefully you can see that, but you can visually see the material filling the well and kind of grabbing that coping. And then with a finger, just wipe this away. You don't want to have to grind it later with a, with a burr. There we are. Okay, and now we let it set. We'll hit it with a light, and we'll light cure just, by the ports, and a little bit of light will go over the top, and then you are locked in and you have your prosthetic converted. We're converted. And the one thing I just wanted to mention is that you want to make sure that the prosthetic is all the way down, that you've inspected it before you start curing. You don't want any of it to be up, obviously. So I've already hit every site with the wand for 20 seconds, maybe a little bit more, and you have now converted a chrome roto prosthetic. And then you'll just simply hit each site. You even know where the sites are because there's the ports. You hit it with a wand, the prosthetic comes off, and you put the little Smilelocs in the mouth, and then you just simply clip this in. And that is a chrome roto conversion. Now, one more thing to remember is that when you do take this off, you'll probably have some voids around those Smileloc copings, and you'll just simply use some stellar material, and you'll carefully backfill. You don't want to get any material in the coping, but backfill around each coping until it's nice and finished, and then use a burr to adjust any material, any excess material, and then you can adjust the lingual if you wish it to be a little bit narrower. You can adjust some of the buckle, the flange, the area up here too if you wish. But otherwise, it's like a simple process of just cleaning this up, adjusting a little bit, and delivering it to the mouth.